The suit says that UnitedHealth banks, quote, on the patient's impaired conditions, lack of knowledge, and lack of resources to appeal the erroneous AI-powered decision. Quote, the fraudulent scheme affords defendants a clear financial windfall in the form of policy premiums without having to pay for promised care. Here is UnitedHealth literally tossing Granny and Grandpa off the cliff. Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan with Status Coup. In the aftermath of the murder of UnitedHealthcare CEO Brian Thompson, UnitedHealth Group CEO Andrew Whitty has solemnly been mourning the life of Brian Thompson, sending out videos to employees, talking about UnitedHealth's, sacred role as guardians for unsafe and unnecessary care. While he does that public mourning, apparently quietly, they are celebrating financial records they are hitting in 2024 by ripping off you, the American people, and the sick masses. This from the Wall Street Journal. Whitty has been telling company executives during meetings and rank and file employees in videos that the work they do is important, life-saving, and deeply appreciated. Following the killing of Thompson, who had run the company's health insurance division, more quietly, Whitty is telling executives that the company is expecting to hit financial records by the end of the year. Let's get into those records, shall we? At the helm of UnitedHealth, Whitty led an era of rapid growth. It bought up doctors' offices and technology providers. Revenue through September of this year eclipsed $299 billion, a record high, and up from $277 billion in 2023. We'll tell you in a bit how they made those billions, much of it by fraud. When the company's shares peaked in November, they had risen about 90% since Whitty took the helm. Even before Thompson's killing, UnitedHealth's winning streak was already starting to falter. Wall Street has been worried about that UnitedHealth, like other major insurers, could get hit next year by rising medical costs and a crackdown on their pharmacy benefit business practices. Inside the company, employees complained of burnout, low wages, and internal systems that reject medical procedures that should be approved. So, as they are hitting financial records and historic revenue, they're apparently paying their workers shit. And workers have been internally complaining that they are unethically, and I believe criminally, denying health claims that should be approved. If you missed it, I did a video yesterday or 2 days ago with a more recent whistleblower who worked at UnitedHealthcare. She described the systemic culture where supervisors are basically hovering over the workers, mandating that they deny claims that should be approved. If you missed it, we'll play it.
You were taught so many different ways to deny. Tell me more about that. What did you feel you were encouraged to do?
Every policy is completely different. So there was medical jargon in each policy that led us to have to follow these procedures. But more or less, we weren't given proper instruction to actually pay the claim. And there wasn't enough monies in certain files in certain companies to pay medical claims. So we would have to just get the client off the phone as fast as we could. And then if they weren't liking what we were saying from the script, then we would just call a supervisor and they would stand behind us. And while I was crying, they were laughing.
You would actually cry on the job sometimes?
Oh my gosh. It was so sad. It was so heartbreaking. I was the bad guy every single day. Does that not feel good to anyone? Like, that doesn't feel good to me.
So while I was crying, they were laughing all the way to the bank as they deprived you, the masses, of health care that you're paying into in this total scam of a capitalist for-profit predatory system. She went further into detail on one case that was heart-wrenching. Let me play that in case you didn't watch the video. This is her sharing a horrific story of UnitedHealth literally taking a widow of 5 children to court to not pay the hospice bill for the widow's dying husband.
I worked in the medical claims department and went through training for about 2 to 3 months to get out on the claims rep floor, and was taught so many different ways to deny. Every policy is completely different, so there was thousands of policies that we had to kind of memorize, which was impossible, but they demanded it. They were so mean to us. But I'm here to talk about one specific claim. It was a widowed woman calling me at least 2-3 times a day, asking if I knew anything, because they were taking her to court for this. Her husband had just passed from pancreatic cancer, and this was a hospice claim. They were already garnishing her wages, and this was less than 60 days after he died. By the way, she was left with 5 boys by herself. She was a stay-at-home mom her whole life. She was just trying to figure out life. There was absolutely no reason why we couldn't just submit this claim and be done. But they told me every which way to deny this, to get her off of our phone line. It was absolutely despicable. But there was one day that I was approved a certain amount of monies. And that amount of monies could cover one claim. A big one, yes, but it could cover one big claim. Big meaning, I'm pretty sure it was like 400,000, 500,000, a lot of freaking money. But they were expecting this single mom to pay it. Oh, and by the way, they took all of her insurance from her. So she didn't work. She had no health insurance. Her boys didn't have health insurance. It's a clusterfuck.
Taking a widowed mother of 5 to court and stripping her of her health insurance because you don't want to pay the hospice bill for her husband who died of pancreatic cancer. That's a way to make record revenue. It's absolutely vile, disgusting. You would think criminal in a civilized country with laws, but we don't live in a civilized country with laws. We live in the United Corporations of America. Also, other ways that apparently they're making these billions that in other countries I think would be against the law. I went through this yesterday in case you missed. Sorry if I'm repeating, but not everybody saw. This was another great report from the Wall Street Journal about how UnitedHealth is essentially just completely scamming the government, i.e. you, out of billions by inventing fake illnesses and diagnoses for their patients in order to get higher payouts. Headline, UnitedHealth's army of doctors helped it collect billions more from Medicare. I'll read just a little bit of this if you missed it. Like most doctors, Nicholas Jones prefers to diagnose patients after examining them. When he worked for UnitedHealth Group, though, the company frequently prepared him a checklist of potential diagnoses before he even laid eyes on the patients. UnitedHealth only did that with the Eugene Origin family physician's Medicare Advantage recipients, he said, and its software wouldn't let him move on to his next patient until he weighed in on each diagnosis. The diagnoses were often irrelevant or wrong, Jones said. UnitedHealth sometimes suggested a hormonal condition, secondary hyperaldosteronism, that was so obscure Jones had to turn to Google for help. I need to look it up, he said. The government's Medicare Advantage system, which uses private insurers to provide health benefits to seniors and disabled people, pays the companies based on how sick patients are to cover the higher costs of sicker patients. Medicare calculates sickness scores from information supplied by doctors and submitted by the insurers. In the case of UnitedHealth, many of those doctors work directly for UnitedHealth. No conflict of interest. More diagnoses make for higher scores and larger payments. A Wall Street Journal analysis found sickness scores increased when patients moved from traditional Medicare to Medicare Advantage, leading to billions of dollars in extra government payments to insurers. Sickness scores for those UnitedHealth patients increased 55% on average in their first year in the plans, the analysis showed. That increase was roughly equivalent to every patient getting newly diagnosed with HIV and breast cancer. Well, that's a hell of a way to make record cash, isn't it? Let's just scam the government by inventing fake illnesses and sicknesses and wrong diagnoses, which not only is fraud and should be criminal if we had a Department of Justice, kind of dangerous for the patient, because if you're an elderly person and you are being diagnosed with X, Y, or Z, which you perhaps don't have, you presumably are then being given medication for X, Y, and Z that isn't really an accurate diagnosis, and you're taking medication that you don't need. Who knows if this medication could harm you, might interact in a bad way with other medications you're on. Who knows? This is total wild, wild west of medicine, for-profit scam. As I've reported, it's not just that. This is not the only way they're enriching themselves fraudulently. Now, like many other industries, and apparently Elon Musk wants all of America run on AI and a jobless robot economy, artificial intelligence has become a hallmark of UnitedHealthcare, and Brian Thompson was presiding over UnitedHealthcare's deployment of AI to deny even more claims that they should have been approving. This is from Newsweek. One criticism of UnitedHealthcare that has garnered attention following the shooting involves a lawsuit alleging the company uses artificial intelligence to deny coverage to some elderly patients who are on Medicare Advantage plan, despite allegedly being aware that the algorithm has a 90% error rate. The lawsuit was filed on November 14th, 2023. It named UnitedHealth Group, UnitedHealthcare, and Navi Health as the defendants. It was brought by the families of two now deceased patients who were denied coverage by UnitedHealthcare for stays at nursing homes. Let me give you some more details. The lawsuit alleges that the provider continues using the system because it knows that only about 0.2% of policyholders will appeal their denied claims, and that the majority will either pay out-of-pocket costs or forego the remainder of their prescribed post-acute care. The suit says that UnitedHealth banks, quote, on the patient's impaired conditions, lack of knowledge, and lack of resources to appeal the erroneous AI-powered decision. The lawsuit went on, quote, the fraudulent scheme affords defendants a clear financial windfall in the form of policy premiums without having to pay for promised care, while the elderly are prematurely kicked out of care facilities nationwide or forced to deplete family savings to continue receiving necessary medical care, all because of an AI model disagrees with their real live doctor determinations. Remember that ad a couple years ago that stirred a lot of people, of Paul Ryan, the former social Darwinist Republican Speaker of the House, tossing Granny off the cliff? Here is UnitedHealth literally tossing Granny and Grandpa off the cliff. It's not just elderly people, by the way, they're screwing with AI, but this specific lawsuit was about two elderly people. So they're essentially, 90% error rate AI deploys. They are creating fake diagnoses for the elderly. This is not exactly in sync with a society where you're taught respect your elders, right? Apparently, beyond the financial records that UnitedHealth is enjoying as the CEO of UnitedHealth Group, Andrew Whitty, publicly sheds tears for Brian Thompson. Apparently, they are on the phones with corporate media too, trying to dictate how they cover the aftermath of the murder of Brian Thompson and the flood of outrage that Americans have been displaying. Let me read this again from the Wall Street Journal. Since Thompson was slain, some workers at UnitedHealth have received threatening emails. The company told employees to stay at home if they didn't feel safe. Armed guards now patrol the company's Minnetonka, Minnesota headquarters. A person familiar with the company said the company is monitoring the internet for threatening messages, including those with images of UnitedHealth executives. Another person familiar with the company said some of the messages threaten the security of UnitedHealth employees and executives. In some cases, UnitedHealth has asked news outlets to blur photos of wanted posters that show executives, or has asked social media platforms to take down concerning posts. The company has asked employees to contact security if they receive a threat or have any concerns, while making grief counseling available to employees, the two people said. Okay, I'm not gonna, say much about enhanced security. Obviously, as we have seen, there are good people that work at these outlets. There are good people that work for-profit healthcare companies. They need to eat. They need to feed their kids. They are not responsible for the fraud. Many of them have left. And we have already shown you stories of whistleblowers. So obviously, we want them to feel safe. We're not talking about being violent against the rank and file workers. But UnitedHealth is calling corporate media, dictating that they blur out photos of the wanted signs of UnitedHealth Group CEO Andrew Whitty. We saw wanted signs of him on New York City subways and other CEOs. Isn't that kind of a conflict considering UnitedHealth and other big for-profit health insurance companies trying to stop saying health care because they're not providing care? Isn't that a conflict of interest since UnitedHealth is directly funding CNN, MSNBC, Fox News with ads? I mean, it's UnitedHealth, Aetna, Cigna, Medicare Advantage ads. I mean, Pfizer. They're calling, basically trying to dictate coverage to tamp down the outrage against said predatory for-profit CEOs. I mean, news outlets get calls all the time from corporations, governments, trying to dictate coverage, but sure seems like a bit of a conflict to me since the same for-profit insurance industry and companies like UnitedHealth that are calling to say, hey, please blur out the faces of, our brave, ethical CEOs are directly funding the anchor salaries through commercial ads. Very interesting. Would love to hear what you say in the comments. I mean, at the end of the day, this is news. This is going around on subway platforms, on street signs. We've shown you street signs were hacked into in Seattle with signs, against CEOs. And, there have been signs around the country, Free Luigi. So news outlets are supposed to blur out the photos that express outrage against corporate CEOs. Interesting. I wonder if they would do that if there were, wanted signs for a, poor black man or, an alleged suspect of a working class person that might actually be innocent. Wonder if they would blur that out. What do you think? It should be no surprise that a company like UnitedHealth is raking in the cash, primarily by fraud. It also should be no surprise that there's going to be no criminal investigations into them because there's rarely criminal investigations or criminal accountability for corporate white-collar criminals. I give you the bankers who tanked our global economy. I give you the fossil fuckers that routinely lie and withhold information on pipeline leaks that contaminate water, animals, air, etc. Hell, we've covered extensively Norfolk Southern, the multi-billion-dollar railroad company, literally unnecessarily chemically nuked Ohio and Pennsylvania in 2023. They detonated 5 rail cars of toxic vinyl chloride, even though they were told by experts not to do it, that there was no need to do it. They did that just to reopen the train lines quicker after the derailment because they were going to lose $1 million a day. The NTSB, the National Transportation Safety Board, testified in their investigation that Norfolk Southern lied to the governor of Ohio, lied to the fire chief to get them to approve a controlled burn, which actually was just an open, uncontrolled nuking of Ohio and Pennsylvania. And there's been no investigation or even criminal charges. So I'm not surprised by any of it. But this is an opportunity for people to come together on the left, the right, doesn't matter, and demand it. Demand criminal accountability and demand governmental action. I don't care if it's Trump. I don't care if it's Harris. We cannot continue to be sitting ducks for this for-profit, predatory, fraudulent, criminal enterprise, which is the for-profit health insurance industry. People need to take action. I'm not talking about violence, but people need to come together. I don't have all the answers, but we need to economically organize, not just against the for-profit health insurance industry, but other industries that are preying and exploiting us workers. Let me know your thoughts in the comments and continue to support Status Coup so we can continue to cover this important story. It's not just about predatory health insurance. It's about predatory capitalism. Support us for as low as $5 a month. StatusCoup.com/join.